I got a comment from one person multiple times on my developmental milestone videos. And I'm not going to put that person's comment up here because I think it's a broader conversation. And I hope that they meant well by this, but let's talk about it. So, in my developmental milestone videos, I talk about what are typical developmental milestones. I sometimes talk about red flags, but I try to be careful with that because development is all over the place. And parents were getting really panicked in the comments about my child is doing this. Is that okay? My child's not doing this. Is that okay? And that was never my intention, was to trigger any kind of anxiety from parents. And so I try to go into the comments and respond back as much as I can. Respond back with a video, talk about that development isn't linear. It sometimes moves forward in one way and then they'll improve, and that these are milestones. They're not definitive. And someone responded in the comments that it was irresponsible for me to not tell people that the development of their child wasn't normal and that they should see a speech and language pathologist. And while I certainly refer to speech and language pathology every single day and have no problems telling parents in my office when we have a relationship as a doctor and a parent-patient relationship, I have no problem telling them that there is an issue and we need to refer out. But on the internet, I'm not your doctor. I am a person who holds a medical license and is an expert in a certain area that is giving education that you should then take back to your child's doctor or healthcare provider to ask them, how is my child doing? Because it's more than just how many words are they saying. It's their growth, their other areas of development, their past medical history. What are they exposed to? And I've had parents even say, well, they're only saying 3 or 4 words, but then I delve deeper and they're actually saying 10 to 15 words, but the parents weren't sure how to count it. So my point to this is, if you see a doctor or a licensed healthcare provider who is giving specific patient information online, run. This is how wellness influencers have now risen to the top of our federal government, as well as potentially being our new Surgeon General, who are offering things that they shouldn't be online. And that's become seen as normal and kind. And thank you so much. I really appreciate it. And I understand that, but it's dangerous, it's wrong, and if you hold a license, it's illegal. So if I give you medical advice about your child, we are establishing a doctor-patient relationship, then I am responsible for your child's health care. And so I just wanted to kind of bring this to light, especially with everything that's happening right now with a doctor who never finished residency, who is not licensed, who has never treated a patient on her own, who has sold supplements and sold you that the medical system is against you and offers advice for things that she does not have the experience to be offering. When that is seen as the standard of care, doctors and licensed healthcare providers like myself need to be even more diligent, that we are upholding those standards with which we should be practicing. So I hope this makes sense, and be really careful yourselves when you're consuming health and wellness information. What are their credentials? Do they actually treat patients? Are they going outside of their scope of practice? And are they telling you things like, only I can tell you what to do, or you should do this with your child regardless of what your doctor says? Take care.